I told a friend of mine not the other day if, she's thinking about having her neck done. And I was like, yeah, definitely go see Dr. Robb. He works miracles.
All right, Donna.
Yep.
All right, so we're about to do a neck and facelift on a 50-year-old patient. She's had Kybella before, she's had submental liposuction, but she's bothered by some early jowling. And so she's bothered by some early jowling. So what we're gonna do today is go ahead and do a platysmoplasty, remove some submental fat, and then we're also going to do a deep plane facelift to really resuspend. I've also talked to this patient about a chin implant, and so we might do that in a stage 2. We're going to see what these results look like, but she's got kind of this cute little chin that if we want a really strong neck and jawline, then sometimes we need to add a little bit of chin projection too. So we talked about all of that, and we're going to start conservative and leave out the chin for now. But what I'm doing here is just getting nice and sterile. Ali. On my side. So just kind of down there. Ali. So, come on for a second here. So now, that chin, this was sitting under there, making that full. Now, so this area under the chin now is super nice and smooth. We took out this fullness, which kind of sat like that under here. Is that better? So this was under here like this, and we took this out, which will leave a nice, very smooth transition. So the other thing we're going to change here is the muscle under here. We're going to get the muscle working for us as opposed to against us. So that is what we're doing here. It's great. Let's see the outcome.
Times like this, a rhyme like this.
I had a necklift and facelift with liposuction. I had this done last Friday, which was 6 days ago. I feel fine. Was able to go to the grocery store on day 4. Still covered up a little bit. Didn't make too much eye contact, but feel a little self-conscious. But nobody said anything. Nobody seemed to look at me like I was strange or anything.
And how was it having your procedure in the office?
Oh, Dr. Robb is wonderful. Very good bedside manner. He worked miracles because I'm not bruised. Not like I thought it was going to be. I thought I was going to be bruised for probably about 3 or 4 weeks. And here it is, 6 days, and probably minimal amount of maybe just a little bit on my neck. I'm glad that I did have it in the office. I read that there's a lot more complications when you do it in a surgical setting in a hospital. And here it just feels a lot more comfortable. Didn't go through much pain at all. I mean, if you can handle a shot or that was about the worst of it, is the shots. I chose Dr. Robb because I had read that he was an ears, nose, and throat doctor, and I wanted somebody that knew everything about that anatomy versus someone that did other things like breast jobs or butt lifts and things like that. So I wanted someone that was an expert on my face.
And are you happy that you went through with the procedure and had it done by Dr. Robb?
Oh yeah, he's been wonderful. I'm glad I had this done. I told a friend of mine not the other day if she's thinking about having her neck done, and I was like, yeah, definitely go see Dr. Robb. He works miracles.